guests and R&R members for taking the time today and this week for the virtual visits to hear and better get to know your local R&Rs across the state. And as you will hear today, R&Rs exist in every county in California and have been the state's eyes and ears, and in partnership with the state has delivered vital services to people on the ground. And because we are deeply connected with each other through the R&R network, you'll see how we're able to move quickly with a level of consistency and unison, and with a local sensitivity and compassion that offers the best of what public community services should be about. The presentations will give you a flavor of what we care about in the policy and budget arena and what we do. And as they do that, I also want to add some context that the local R&Rs were non-acknowledged essential workers during the pandemic. They were open, serving the public, and were the front line, and they still are. And because of their relationships with parents and providers, they were essential in supporting families looking for care when schools and work shut down, holding the fears of parents in their, as they were holding their own fears and helping families. They were essential in advocating for providers to get PPE supplies and funding. And we scoured for products, for funding for supplies. We organized, ordered, delivered these much needed supplies to help businesses to stay open. And they distributed the $50 million that the legislature provided for providers to be safe. They outreached to essential workers in all industry sectors whose workers were in need of emergency childcare. They were essential to informing providers about emergency and changing rules and regulations. They were essential to calling providers regularly, check on them, updating databases on the opening, closing, and just how they're doing, and making sure that they were okay. They were essential in creating activity videos, hosting virtual playgroups in multiple languages to support providers and families at home. The R&Rs were essential to the state in distributing vaccine codes to childcare providers, especially in hard to reach communities. Again, taking the frontline hit of frustration when supplies of those vaccines were limited in the early days. They were essential to helping providers understand opportunities like PPP loans or providing technical assistance to apply for state facility grants that was just recently let out. They have been essential to helping families understand federal child tax credit and creating multiple language and culturally relevant outreach to ensure California's families access this resource. They are essential right now to DPH and DSS on distributing COVID test kits to providers. I think you get my point. They're essential to the state and to the families and providers dependent on them for information, for safety, for stability, and for our own state's growing economy. Please keep that in mind as you hear and learn from them, and understand that they have done incredible community work and with the state and early care learning space, and they deserve some recognition for the contribution during this extremely hard and continually evolving times. So thank you for being here. And with that, I will pass this over to Lara Magnusdottir, our Public Policy Chair.
Good morning, everyone. Thank you for being here. It's good to see so many people here. There's a lot of details that have been provided to you all, and I'm talking about both the R&R staff who are here and legislative staffers. There are so many things that have happened every year. We think it can't get any crazier, and then it does. But the really main thing to remember is our work is really important, and we need additional funding and support to keep it going. It's important to the families, to the children, and to the providers that we work directly with, but it's also important in the context of our communities, of employers, and to our schools and school communities. But it's also important to that one parent that we talk to who needs us to talk them through leaving their infant with someone else for the first time. We are in this line of work because we know it's important and because we care. and we need help to keep it going. So thank you again and enjoy the rest of this morning.
Good morning, everyone. My name is Keisha Nzewi. I'm the Director of Public Policy for the R&R Network. I have the distinct pleasure of introducing my colleague, Gemma DiMatteo, who is our researcher and will present data that all of you ask for all of the time, our childcare supply data for 2021. So with that, I'll hand it off to Gemma.
Hi, good morning, everyone. I'm going to start sharing my slides now. Okay, everyone can see that, okay? Yes, great, thank you. Yeah, I'm really excited to be here with you all virtually today. Today, we are going to present our 2021 California childcare supply data, which has been eagerly anticipated because of the pandemic. And so our last childcare data that we published was from 2019. So we have this opportunity to compare before the pandemic and then kind of right in the middle. I guess we don't know when the middle is, but during the pandemic. And so just a little background, our data comes directly from the Child Care Resource and Referral agencies covering the whole state of California. And most of you know that the R&R's databases have the most comprehensive and up-to-date data on childcare providers and childcare supply in California. And we also do a very extensive cleaning process, which includes a lot of back and forth communication with the R&Rs who are in constant communication with their providers. This is also why there's a little bit of a lag between when we collect the data and when it's published, since California is a very large state, so there's a lot of data. We release our childcare portfolios biannually every 2 years, and this year, our full portfolio will be released in the fall. So today, this is just the licensed childcare supply data. So we have been collecting this data in a standardized way since 1996, which allows us to look at this longitudinal trend of childcare for decades now. And so you can see this top line is child care center supply, and the bottom line is family child care home supply. And this is just licensed facilities. So you'll notice that before the recession, everything was increasing as we needed it to. And then after the recession, family child care homes were hit really hard. Not surprisingly, they are small businesses operated out of an individual's home. And centers were less impacted by the recession. Interestingly, this past year, we see that the family childcare decline has actually, it's had a smaller decline than what we would have expected, than the trend we were seeing before the pandemic. And centers have experienced the biggest decline we've ever seen since we started collecting the data. This is also not very surprising considering the restrictions in group sizes from the pandemic that made it harder for centers to continue operating. So this is a breakdown of the change in supply. So this is licensed capacity. So for total number of centers statewide, we see about a 1% decline. For center spaces, about a 2%. Interestingly, when you break it up by age, there is actually an increase in infant capacity, which tends to be the sort of the hardest to find. So that's something we work is to increase infant capacity since it's the most expensive to provide. So for some reason, there was actually an increase in the infant capacity in centers. And the biggest decrease we see is with the school age capacity. And so this is the family child care home breakdown. So there was a 4% decline in the number of homes, the number of family child care homes, which equates to a 1% decline in spaces. And this is not broken up by age because it's one license for all age groups for homes. So these percentages might not seem really big, but California is a huge state. So even these percentages equate to almost 18,000 less spaces for children. And it's not like we were starting off in a good place where we had a space available for every child. There's over 6 million children, 0 to 12 in California, and less than 1 million licensed childcare spaces. So this means about 15% or 3 in 20 children have a licensed space available for them. So we want to keep seeing the increase that we were seeing before the recession, not any kind of decline. So there were some significant regional differences in the data. The North had the biggest decrease in licensed supply, coming mainly from centers with a 7% decrease in center spaces. And that's followed by the South, whose decrease was a little more evenly distributed between centers and homes. Central Valley had a smaller decrease and a small increase in homes, actually. And then the Bay Area actually had a small increase in supply and an increase in centers. And from 2017 to 19, we saw that the North and Central Valley actually had an increase in supply, a small increase. And the Bay Area and South saw a decrease. So trends just have changed. So these are some maps comparing by county, the change from 2019 to 2021. So this is total supply, total licensed supply from centers and homes. So anything that is green is an increase, and anything yellow, orange, or red is a decrease. You can see it's a little all over the map, no pun intended. This is the change in number of homes, so home providers. And this is the change in center capacity. We look at number of homes because they are a small business connected to one person. And then this is center spaces, since their capacities can vary so widely. So this is the change in center capacity. We'll have all of these slides and maps on our website, so you can go through and look in more detail if you want. So we were curious about how the pandemic might have impacted parent choice in setting of childcare, particularly parents with subsidy. So this is parents using a childcare voucher, comparing fiscal year 2019 to 20 and then 20 to 21. And you can see, so family childcare is historically the most popular choice by parents, but it looks like the pandemic might have decreased center use. It had the biggest decrease, 9%. And then license exempt care decreased by 4%, and family childcare was less than 1% decline. So just an interesting snapshot of how the pandemic might be influencing these subsidy parents. And center capacity did decrease, but family childcare capacity decreased too. So I don't think these trends are only because of the change in supply. It's just that the center decline was bigger than what we would have expected. Then family childcare, we usually expect a big decline. So what does this mean for policy? So it's probably surprising that the data shows that the childcare supply decline is not as big as people thought it would be. And while we can't be 100% certain right now of the reasons why, we do know that childcare received a lot of attention and financial support in 2020 and 2021. And it is likely that those played a huge role in preventing a steeper decline in supply. So some of the things that include stipends to all licensed childcare providers, bigger stipends for childcare providers that care for children with a subsidy, Providers that take subsidy getting paid based on enrollment and not attendance of the children, waiving family fees, providers getting cleaning supplies, food, diapers, PPE, home COVID tests. So this shows that when we give money directly to providers, we create a more stable childcare system for families. So because of this, we have the following policy recommendations. So we recommend increasing pay for all childcare workers, continue to eliminate the family fees to the extent of the law, and codifying paying subsidy providers based on enrollment and not attendance. And you'll hear more about these recommendations later on in the program. So just to summarize, despite a decrease in supply, public support for childcare during the pandemic likely prevented a much bigger decline of supply. Centers seem to be more impacted than family childcare homes, probably because of the restrictions on group size. There's a lot of county and regional variation in the change of supply. And if we want to prevent more decline or even go back to our pre-recession increase, we need to have continued public investment in childcare, not just during a pandemic, but all the time. Thank you all so much for joining us, and a huge thank you to all of the R&R agencies for all their work, keeping their databases up to date and clean and talking to us about it all the time. We really appreciate all of you and the work that you do with families and providers and with us with our data work. To visit your county's supply data, you can follow this link below or go to our website under research. It's in our childcare data tool. And we will open it up now to questions. And my email is below. You can feel free to email me questions as well. And will you have any questions come in the chat box?
There are no questions, but Laura made like a good comment about holding providers harmless made the difference in them staying open.
Yeah, definitely.
And they're just comments saying thank you and very informative presentation.
Wow. Thank you. Okay. I guess we'll move on then. So we're going to move on to talk about policy priorities that can help us address the availability of childcare throughout California. To talk about the heart of R&R, let's welcome Kerry Venegas, Executive Director of Changing Tides Family Services in the R&R in Humboldt County.
Hi, good morning, everyone. I'm Kerry Venegas. I'm the Executive Director of Changing Tides Family Services, and we're up here in the Great Northwest amongst the redwoods in extremely rural California. So glad everybody's here. R&R is our passion, and we do so much in the community. So first, I just want to share that when I explain what R&Rs do in our county to folks who live in our county, I start by saying that resource and referral agencies are the agencies that community built, right? So we're from the community, we're in the community, we're by the community, and we're for the community. We've literally grown up and we've been around for almost 50 years up here. We literally started because of the community need and our parents' need for childcare and for easy, accessible resources to find care where they could trust their children when they go to work and school and anything else that parents need. So one of the things that I think is so important to realize about R&Rs is that we are kind of like the Marine Corps of the childcare ecosphere. We're the first ones in, we're the last ones out, and we do everything in between it takes to get the job done. So one of the shining things has been in emergencies, we are a touchstone. The entire pandemic, never once did we not answer our phones or respond. We were the voice on the other end during the hardest of times in those early months. And a lot of the work that we do doesn't show up on charts necessarily, but it's the heart of R&R. We're that friendly voice, your neighbor down the street who knows what it's like when you don't know where you're going to have care for your child. We're the ones who can tell you where to find food support. We're the people who actually delivered food boxes in the 6th month of the pandemic, because we were literally the only organization that was able to go out into the far reaches of our most rural areas and make sure that we were also delivering all the protective equipment supplies to every child care provider across 4,000 square miles. Even more, we're really a good dollar investment. So I want to acknowledge and recognize that one of the most important things that happened in this past year was that extra infusion of cash that R&Rs received across the state, and express my gratitude and appreciation and tell you what that let us do. So that allowed us to leverage some additional time from some of our staff to do some extra parent support services, to offer parent cafes and a hot meal for folks who had been really isolated for a long period of time in the 2nd year of COVID. It let us expand our outreach to support all of our childcare providers in keeping their doors open, accessing different funds, ARPA funds, county funds, and to come together to really work hand in hand with all of our partners across our county. Granted, we're a small county, but we're a wide geographic space. When times get tough, we partner together, but it's really great when you have an extra set of hands to be able to do that much more. In fact, in our organization, I sat down with our finance folks and I figured out that every dollar that comes to us in our R&R funds basically gets leveraged for $5 more across programs in our community and across programs in our organization. And the great thing is that our R&R is based in the heart of an agency like ours that does so much more, including children's mental health, support for disability services, food and nutrition, support for childcare providers, active play, and respite care. So every time our R&R is working, every dollar goes that much further. So I want to really say that one of the important things and one of the reasons we're here today is we want to, not only do we want to be very thankful and appreciative, but also to let you know that the shortfall is still a thing that's actually impacting a lot of our agencies across the state. We've hung in there through COVID. We've kept our doors open. We've leveraged everything. When COVID tests need to get out the door, we got them out the door in 4 days after receipt. You know, we're nimble and we pivot, but we do need some additional support. R&Rs have been historically underfunded, and we know that with a little bit more money, keep in mind, you give me some extra dollars, I'm going to leverage $5 more for every dollar in that. And I'm not alone. All of our agencies do this across the state. I think that there's also a disparity, and I want to say that we kind of have a joke in my county that almost everyone who works in social services in Humboldt County has actually worked for our organization at some point in our 47 years. And we end up becoming a real training force. And so that's amazing, right? That's great because that builds a lot of relationships. And I never go into any kind of meeting, virtual or otherwise, where I don't find at least 1 or 2 people in my community who have actually worked for my organization. But the sad part of that is that I have to pay people less than In-N-Out Burger that just opened in Humboldt County. And that makes it really hard for us to hold on to all of the staff who put their heart and soul into this. Because the people who come through my doors to do this work come through it because they see that it makes a difference in the community that they love. They're here because they love families. They're here because they love children. They're here because they want to make a difference. And I really want to be able to respect everything that they've done by paying them a living wage, that they can walk out the door and know they can put gas in their car, food on their table, and have childcare for their own children. So I think it's really important. And this is why with gratitude and deep respect for the increase that we got last year and for the support that we have felt being part of a bigger system addressing a major pandemic and disaster and fires and other things that have happened in our state, we know how much more we're capable of. And when we're ready, we can do anything. And when we partner, we are amazing. And when I have good people in our organization, I honestly think that there is no change too big and there is no moment too small that we can't meet parents, families, and our community at the door. And that's really why I am extremely passionate about R&Rs. And one more thing that is kind of a little hidden gem about R&Rs too is we are an extremely diverse workforce. As a matter of fact, because so many of our positions are entry-level positions for people who want to be passionate about doing the work on the ground, the majority of people in my organization represent a wide diversity. We're a county that has 9 tribal nations, and we actually sit as an agency on Wiyot land, which I always like to acknowledge and pay respect to. A lot of my employees and also the families we serve are incredibly diverse. Multiple native languages, multiple community languages, and many cultures. R&Rs have this potential to add equity into any dollar that comes to them and to support the learning, because the more diverse our workforce is that come through our doors and go out to work in our counties, to work in our foundations, to work in other social service organizations, the better our community becomes and the better our state becomes. So thank you so much for letting me share a little bit about what R&Rs do. There is more information, and the data will give you a good picture, but also the services we do, the free childcare referrals, the professional development, the support for all of our childcare providers, from family, friend, and neighbor, all the way to licensed centers, is critically important. And then the intangibles that we do in just being that voice on the other end of the phone, that's the heart. Thanks so much. And at this point, I believe I need to hand off. Emily, are you putting R&R survey infographic in the chat?
Yes, you just have to hand it off to Micaela.
I'm going to hand out to Micaela then. Thank you, Micaela.
Hello, everyone. My name is Micaela Mota, and I am a parent. I'm also a parent leader with Parent Voices in Contra Costa County. I also have with me Madison. I'm trying to keep him busy by eating some grapes while I present to you some information and to share with you a little bit about my story these past 2 years. So first and foremost, how did the pandemic impact me? Well, I was an essential worker. I still am an essential worker. But at the time, I was a mental health provider for adults with severe, video is off. Oh, okay. Can y'all see me? Sorry, I'm like distance. Okay. So the pandemic had impacted me because first and foremost, I was not able to stop working. I was an essential worker with working with severe mental health clients. And so I needed childcare, and I needed very dependable childcare at that, right? So what had occurred was I was also on a wait list for subsidized childcare that I actually put my child on the day after he was born. When the pandemic hit, I found out that I was there were 1,000 families ahead of me on this subsidized childcare wait list. And because of the emergency voucher that Cocoa Kids helped me access, I was able to move up on that list and get the subsidized childcare. Why did I need subsidized childcare? I was a graduate student working 2 jobs. One as a mental health provider, as well as an Uber Eats driver, just to be able to make my basic needs met, as well as to be able to pay for childcare. Madison singing for all of us. And so what had ended up happening is that with this emergency voucher, I was able to move up on the list, as well as not having to pay any family fees, which definitely allowed me to not have to continue working that second job as an Uber Eats driver. Thankfully, too, I was able to be home, to be able to spend time with my son, right? This is so important for me to be able to spend these precious moments with him, especially in May of 2020 when he contracted COVID himself. He's A-okay, we can hear him sing. Yeah, he's singing. And so everything was great. And so what has happened as well is, I know, Papa, parent voices Contra Costa statewide and the R&R network are working to end family fees for good through AB 92. And I've been really, I'm going to step out of the car. I've been really fortunate to be a part of that movement with Assembly Member Reyes Gomez. And so this has actually also provided me the chance to pay some utility bills that I was not able to pay for quite some time. So freezing of family fees has saved women of color with limited incomes over $60 million since July 2021. And we need to pass this $187 million budget that we asked to extend family fee waivers until 2024. You know, don't pull the rug out from underneath parents like me. Like, I need it. I actually, I don't know. Well, I'm able to take my son where we're at right now is we're at Disneyland. And I haven't been able to provide him this sort of exposure. So that's where we're at right now. I'm able to give him this sort of happiness. And so he's like, why are we not at Disneyland? Why are we in the car? Because this is important to me as well. Coco Kids has also helped me find a provider outside of the provider that I already have. I did go into receiving this emergency voucher and my work with the R&R network, already having a provider. But when my provider has had to have unscheduled closures because of the pandemic, or when it's other reasons that I cannot access my regular provider, they are there. They are there to help me. There was a point of time that I didn't even know I had it. And they were like, no, we got you. Let's go ahead and have you, have a second individual to be able to provide for your kid. And that was like a sense of relief because, again, I'm an essential worker. I am currently a bilingual school psychologist in Richmond, California. And I need to be there for work, not only to be able to provide the support for my family, because my husband is another essential worker, but also because I need to be able to provide these services and support to our children, to our youth, our children of color at Richmond. It's very, very important. And so the agencies and PV members are working together to support real needs of families, right? Needs of families like myself, needs of families just throughout the community. I really don't know where I would be without Coco Kids, without the R&R. Like, I really don't. I have no clue how I would have been able to get through these past 2 years. The sense of family, the sense of community. And I definitely believe that, we need to support organizations and agencies like such because they help the movement of our communities. Of the essential workers, of the basic necessities of mental health, the basic necessities of connection, the basic necessities of community. And so the R&R network also supports parents to find childcare through their mychildcareplan.org website and helps providers like mine to get supplies and PPE to get through the pandemic. Childcare providers should not be going into their own pocket, right? They're already getting limited funds. They work so hard. They go above and beyond. They were paying for Wi-Fi, increased connectivity, through the pandemic. And then we're saying, okay, but you also need to not only be open through the pandemic, but get your own PPE. We can actually help them out a little bit in this, right? Like it only makes sense. And so, I'm very grateful for that. I'm so grateful for that because my childcare provider does above and beyond, and they take care of my child, and they're teaching him the early childhood developmental skills so that he can move forward when he enters kindergarten and elementary school, and just have those resources, that social emotional support. And so, you know, I'm all about this, and I just needed to speak, and I needed to share my story of how Cocoa Kids and R&R has been part of my family, has been part of my life, has been part of my my family's life. And without them, I really don't know where I would be at all. So yeah, that's my story. They have been the wings as an angel for me. And I really just, I don't know how much more I can say. Well, this is where I'm at. I'm able to take my kid to Disneyland, like, thank you, right? Like, thank you so much for allowing me to have this memory with him because of all of these different resources. And I wouldn't be able to do any of this without y'all. Just my mental health, my kids' mental health, my family's mental health. I can breathe. I've caught up on my PG&E. And I'm saying this to the whole parking lot, like I have. So thank you so much with the family fees and just knowing that I have resources that I didn't think I was ever going to be able to have. And yes, Madison definitely is being very patient. So maybe he'll even get a balloon. Maybe a balloon. So yeah, that is my story.
Many, many, many thanks so much, Micaela. We're going to move on now to talk about provider pay with Justin Blakely from Crystal Stairs.
Thank you. And Micaela, thank you for that very profound story, and definitely get Madison that balloon, and even something even greater than that too. He excellent singer.
Might even get a churro.
There we go. I absolutely.
Yeah, he wants
a good metro. But good afternoon or good morning still. Ooh, sorry. Good morning still, everyone. My name is Justin Blakely. Excuse me, I'm the Public Policy Associate here at Crystal Stairs, located in South Los Angeles. We serve over 45,000 annually. Of course, the R&R agency, and I really want to be able to discuss the disproportionately low childcare provider wages and rates that the current system is facing right now, and why it's so important, from the stories we've heard already to what we will continue to hear as this year goes on, and quite frankly, what we even haven't been able to hear yet, for why this is such a dire need and it needs to be addressed immediately. So it goes without saying that the ECE field, the system is in a crisis, right? And we really need to look at addressing this disproportionately low childcare provider wages and rates from a racial equity lens, right? Because this disproportionately is affecting Black, Latinx women, and also just women of color and all other marginalized groups, right? And I really want to be able to, before I get into some different policy things that are going on, I really want to be able to give you a story from a provider that we work with in the Crystal Stairs service area, and just how dire the needs are, and where really our people are when it comes to being able to know if they're going to be able to continue their business tomorrow, even today, waking up today and knowing if they're going to even continue forward, right? So, and this is a seasoned provider. When I say seasoned, I always like to, contextualize it with, this is a provider that has been serving our community for over 20 years, right? She said this, and I quote, the experience of being a childcare provider through the pandemic became very devastating as enrollment dwindled, and while also trying to figure out where funding was coming, if it was coming at all, how to sustain staff, maintain her own personal bills, her business bills. She reflected that it was her lowest point of being a childcare provider in the South LA community, in our state of California, right? And also she added that, she reflected that she's been a childcare provider since 1999. And what I really want to be able to highlight is that she has also talked about the fact that, she is facing housing insecurity. She's facing food insecurity, right? There are many, a host of things that are going on that are really disproportionately impacting our women of color within the system of the ECE field that are serving our children and really making the real impact that's needed before they go on to the K through 12 system. So I want to kind of talk about what the ECE Coalition ask is and what we're really trying to push for in the state legislature as we come up upon the May revise and we're still within these budget talks, right? But I really kind of quickly highlight what the ECE Coalition is. I'm sure many of us know, but I want to kind of set the stage. The ECE Coalition advocates for state budget investments and policies that support the coalition's vision of childcare and early childhood education systems that serve and meet the diverse needs of all children, families, and ECE professionals, especially Black and Latinx people and other harmed by systemic racism and historical injustices. Integrate culturally, developmentally, and linguistically relevant and responsive high-quality care and education for children, inclusive of children with disabilities, and value and justly compensate all who serve children and families, right? And so last year, when it comes to race, last year, the childcare rate increase got providers up to that 75th percentile of our 2018 regional market rate survey, excuse me. In the pre-pandemic life, under normal circumstances, those funding levels would have kept up with the normal rise of inflation in 2019 and 2020 as well. While we greatly appreciate that type of increase, we're not saying we don't, that's just simply not enough. And I know I'm preaching to the choir when I say this, right? And just to kind of break down just to kind of illuminate what this 2018 R&R survey increase looked like was a $4 with the last year of implementation taking effect in 2023 for smaller providers. Since 2018, the inflation has increased 11%, with a 7% increase alone in 2021. Early data from January of 2022 indicates that the national labor crisis has finally hit the childcare profession. Minimum wage increases and inflation also impact California's Head Start programs, which provide that high quality care, and we work with them all, right? And one thing I just want to lastly highlight, a couple things, is that according to the Center, of Child Care Employment, nationally, the childcare industry is still down 100,000 jobs since February of 2020, right? And we're not even talking about what has still been lost as we're still kind of figuring out who is able to track data, who is able to continue to update us on how many people are still, how many providers we're still losing in the system, right? Again, as we speak right now, there's providers still deciding on if they can be able to continue. And so the ECE Coalition requests, as it comes to race, is that we are requesting a 20% across the board rate increase to help providers keep their doors open. And obviously the 20% increase, that's just to be able to keep us at a reasonable level, but we need much more, right? It's going to take much more, and this investment must not just be the rate increases, but we have to also come around and look at the holistic approach of how we can not only give our providers the tools to advance, but and it's not about giving handouts, it's about giving hand ups to our childcare providers and those who have been on the front lines for the state of California and the nation. And it's just very important that we continue to press upon that this is a thing that we really need to address from a racial equity perspective, and let people know, let the legislatures, let all our stakeholders know, let our community know that our childcare providers deserve much more. So I want to yield. Thank you so much for your time.
Thank you so much, Justin. Next, we're going to have Dr. LaWanda Wesley talk about a bill that we are co-sponsoring, SB 976, related to universal preschool.
Hello, everybody. Happy Wednesday. I'm so glad to be in community with you today. I am Dr. LaWanda Wesley, and I am with Child Care Resource Agency, and I'm excited to share with you about SB 976. I wouldn't say that Micaela just touched my heart, touched my spirit, because I was her with 5 children as a single mom, but here I am today talking about SB 976, and this is really related to thinking about universal preschool, the Universal Preschool Act. Back in the fall, we had an opportunity, Child Care Resource Center had an opportunity to co-write a white paper, and that was with the California R&R Network, Every Child California. We also have new sponsors just came on, First Life California, but the white paper just lifted up the need to really think about that families need to have choice. Micaela needs to have choice where she wants to send her child. I was that mom who had 5 children trying to figure that out. We know that TK is a new grade that has just been added. And we are happy that that's there as a parent choice, but we want to make sure that we build out the rest of the early learning system and the rest of the continuum by offering opportunities for families to place their child, whether they want to choose a school-based program or if they want to choose a community-based program. We do not want that choice taken away. We know that children thrive in environments that are unique to their needs. We know that families make the best choices for their children, and they should have the option to do that and not have it be a false choice. And so what we are urging you today, and I know they're putting it in the chat, is to support SB 976. This is a bill that's being championed by Senator Leyva, and it's going to be heard next week on April 6th in the Senate Education Committee. And we're really excited about that because this is the first time it's being heard on a policy level. And it will also be heard through HHS on April 19th. So we just want to make sure that we lift up family choice. We want to make sure we're building out the rest of the ECE continuum system. We don't want families to feel stressed that they can't place their children in programs and options that best fit their needs and what it is they need. I will say, like Micaela, I was that parent trying to struggle where to put 5 kids in here in Sacramento. And because I had that choice over 20 years ago, I was able to go on and persist. I was able to start paying all of my bills, not just thinking about one or the other. I knew that my children were in good quality childcare, all 5 of them. And I since went on, was able to finish my doctorate degree because of that. So I was that subsidy parent, but I also was a preschool teacher providing the support to the Micaelas of the world. So I know what that looks like. And we don't want choice to be taken away. We want to build out a universal system that benefits all of our children and our families, and that they're in developmentally appropriate programs. We know that in community-based programs. So I'm just going to leave it with that. I know we don't have a lot of time, but I'm excited to be here. And we're excited about all the champions who are supporting SB 976. Thank you, California Resource and Referral Network. Thank you, Every Child California. Thank you, First Five, for coming on. Yes, as a recent co-sponsor, we are excited. And I'm just glad to be in community with all of you today. And I'm going to pass it back to my colleague, Keisha, and I talked really fast.
Thank you so much. Thank you to all of our speakers. In fact, and I am your final one. So let me share my screen. There we go. All right. So now I'm going to present on a short report that we're providing based on focus groups that we conducted last summer. Before I start, there are many of the folks who participated in those focus groups are here today, who gave their input, and I want to thank them for all the care they provide our children, whether they're the parents or the child care provider, and thank you for just sharing your truth. And so here we go. Here's what came of that. First, I want to start with the reminder that the legacy of childcare in the United States begins with enslaved Black women caring for the white children of their enslavers. For generations beyond American chattel slavery, Black women, then other women of color, were trusted to care for the children of white families. One of my favorite memories of my childhood is the love and safety I felt in my grandmother's arms, a woman who also cared for other children. She owned for her own family childcare business, but she retired when I was a toddler. However, she continued caring for my oldest childhood friend, a little white girl whose mom needed to go back to work as her teacher. That's Katie in the picture on the right. That's me, obviously, with my grandparents on the left, and me on the whatever little playground toy. And it seems that my own selfie picture taking comes honestly because I can, okay, Linda, you could have just said that. I see that you see my notes. So I'm going to stop sharing and reshare. Hold on. Don't know why you see my notes. Then I need to, you can see that, right? Can you still see my notes? Okay. So Katie is there. Katie and I are still very much family. We've been friends since I was 11 months old and she was 5 months old. But her mom convinced my grandmother to again care for a young child when her sister was born 7 years later. Her mom trusted no one else to care for her infant child. Had they been asked at the time, my own mom and my friend's mom would have agreed that my grandmother's care was high quality. But my grandmother had no formal education beyond high school. Her qualifications were that she raised 3 children and, like most women of her time, gladly watched other children when their families needed help. Nonetheless, her lack of education alone would limit her quality rating, had it existed then, in the quality rating improvement system, which was established about 30 years ago. Mostly driven, designed, and influenced by highly educated white women, QRIS resulted in tools and a system that uplifted a Eurocentric view of care while diminishing the expertise and value of care that Black women had provided for centuries, first as enslaved caregivers, then domestic workers, and now as child care program owners, directors, teachers, and assistants. If we were to depend on the traditional QRIS alone, most of us received our early care and education in low quality settings. While I think our families would disagree, QRIS takes into account few aspects families would use to define quality care. This results in the care mostly provided by Black, Indigenous, immigrant, multilingual, and other women of color, and by default home-based care being characterized as lacking quality. But what does QRIS have to do with it? So, like I mentioned, over 30 years ago, in order to, quote, assess, improve, and communicate the level of quality in early care and education settings, QRIS were developed across the United States to increase the likelihood that childcare subsidies would support high quality care for young children. These systems were built in response to the notion that most childcare in the US is low quality and, quote, children from low income families and minority families are more likely to be in low quality. Now, the intention of QRIS is good. It's intended to help parents know the level of quality of the childcare programs they're considering. And QRIS provides professional development opportunities to providers such as coaching or mentoring, technical assistance, and training. And so each state was tasked with establishing their own system. And in California, our QRIS is called Quality Counts California. So all that I talked about before is about the bigger, broader QRIS system, not necessarily our own QCC, Quality Counts. Our QCC is a statewide system implemented at both the county and regional level. QCC allows providers working in all childcare settings, including family, friend, and neighbor, to participate, providing opportunities for professional development through coaching and mentorship, training in the community, and access to higher education. QCC programs also help parents understand the importance of identifying a quality childcare environment. But what is quality and who gets to decide? So in our QCC, quality is measured often by the education level of providers, the adult-to-child ratios, and school readiness, and other measures that use standardized tools. Childcare programs, although the rating is suspended right now, but when they were, childcare programs were rated by professionals in the field who may or may not have direct experience caring for young children in the setting they are rating. Childcare programs in California CCC could choose not to be rated, but still participate in the improvement activities their local QCC offers. And so as it is now, quality ratings are determined by the QCC rating matrix. That includes the things that among many others, the things that I've mentioned. But does it capture what childcare providers and parents see as high quality childcare? So we asked the childcare providers, why did they get into this business? We heard Justin describe how poorly paid they are, and we heard Kerry describe even how hard it is now to just hire R&R employees because In-N-Out opened and they might pay even more up in Humboldt County. And that's actually true across the state. But when I asked the question why of childcare providers, and they worked in all settings, whether they were family friend or neighbor, family childcare providers, or it worked in a center environment, when they were asked why did they choose to do this, I can't tell you how much their faces light up in joy and delight. Among home-based providers, it was very common that they established their licensed family childcare home or provided care for a relative, friend, or neighbor because they had children of their own. They needed a way to both care for their own children and bring in money to their household. But while necessity may have been the initial motivator, their love of children made them stay. I loved how Justin referred to them as seasoned. Most everyone that we spoke to had been in the childcare business for well over 10 years, many approaching 30 years. Providers really see themselves as an integral part of building a strong foundation for children and helping them grow. So when asked, what does quality childcare look like? Parents and childcare providers alike easily provided answers to a question that few had ever been asked before. Nearly everyone responded quickly that a safe environment is essential. Providers described meeting the unique needs of each child as a hallmark of providing high quality care. There's no one size fits all when it comes to caring for children. Parents spoke about the importance of being able to trust their provider, and they almost like they want to leave them with someone who is just like them. It's like leaving them in their own home with just replacing the parent. And both parents and providers shared that wholesome, nutritious food was a sign of a high quality program. But critically, the one attribute of high quality childcare that everyone agreed on is love. Expressed repeatedly, parents and providers felt the most important trait of a high quality provider is the love they generously share with children in their care. Food is love, hugs and kisses are love, nurturing and providing individualized care is love, and trust is love. While quality is love, as one respondent said, love doesn't pay the bills. So what do providers need to do their best work? The most important things providers said they need is to be their very best is better pay. Family sustaining wages would allow them to worry less about supporting their own family's needs, keeping them focused on their jobs. More money would also allow them to seek higher education, which many of them desperately yearn for. While love of what they do and the children they care for and their families keep many providers in the profession for decades, respect for their expertise, whether learned in a classroom, at a workshop, from a mentor, passed down from their family, or gained over years of experience, a simple need many in the childcare workforce are missing is respect. And then among those who have been rated in Quality Counts California, none of them felt like the process acknowledged their expertise or respected them as professionals, and none used their rating to attract families to their program. Some were so discouraged by their raters' first visit that they complicated leaving the profession. And a lot of that went back to what I mentioned earlier, is that raters often are experts in the field, but did not have experience in rating the type of setting that they were visiting. So our conclusions are: love is quality. Parents and child care providers just want their children to experience the love they experience at home. That comes through trust, food, hugs, and learning. Good wages support quality. Providers need to be paid wages that allow them to support themselves and their families without worry. When they're concerned about how they'll feed themselves or keep their lights on, it makes it hard to show up as their best selves to care for children. And respect supports quality. No matter the childcare setting, everyone who cares for and educates young children, even a family member, deserves respect for the experience and knowledge they bring, no matter the formal schooling they may or may not have. So our recommendations mirror very closely what we've all learned about preceding this presentation. Executive function research and provider input should influence quality standards. Those obviously who do the work can best define what quality is. Quality definitions should be driven by parents and people who care for children. Black, Indigenous, and people of color should be intentionally included in the work to define quality, because that's what was missing some 30 years ago. Increase wages for the childcare workforce and support training and education. The providers who participated in our focus group love learning more. They want to learn more. They love being together and engaging with one another. And that was one of the best, their favorite things about QCC was the opportunity to be in community with other childcare workers. So you can find the report on the website, which I think is being dropped in the chat as well. And it will subsequently be followed up with a podcast where we've interviewed people who've worked in the field for a long time and parents about what quality means to them. So thank you. I'm again in deepest gratitude to the folks who shared their stories that informed this report. So now I just want to wrap up that we want more pay for childcare workers. We want to waive family fees to the extent of the law. We want more funding for R&Rs. We want to pass SB 976 so that we have a true mixed delivery universal preschool system in California. And have I missed anybody? I don't think so. But I also want to encourage you all at 1 o'clock in just a couple of hours to join a national Twitter storm that is being hosted by Parent Voices California, which I think will be, could be, Emily, it is on our document. I just put it there. It was a late ad so that you can sign up and get your Twitter on. I'm not good at it, but it's, you know, that childcare is kind of stalled in Congress right now. We did not get Build Back Better, but it's not over. And so to join all of our national partners in this Twitter storm, let's see, I'm sorry, I'm not sure if Emily can find it, but here, I've got it right here. It's called the She Ready, We Ready for Childcare Twitter storm. And there's some details, and then here is the link to sign up. It's just a Google form, so it's quick. And, oh, it's tomorrow. Sorry, at 1 o'clock, my week, I don't know what day of the week it is. Tomorrow at 1 o'clock, join it. Be there, be square. And hopefully you've caught the legislative packet that's been posted in the chat throughout this morning, which has fact sheets and whatnot that back up all of the things we've talked about today. And with that, I think we should go about our day. I did it in 1 hour and 15 minutes. This was from 10 to 11:15. So we did it. And to all the R&Rs on the line, you look great. Thank you for the solidarity. You've done amazing work these last 2 years. And just as everyone from Linda, Lara, Kerry, and Micaela have talked about, you are amazing and such a gem to all of our communities. So thank you. So everyone go off and have a great day.